Hey guys, welcome to How to Lose Weight and What I Eat in a Day channel. This video exposes the secrets behind how to avoid getting pregnant. What you can do to avoid getting pregnant are itemized below. Forbearance is the best way to genuinely evade pregnancy, yet in case you're explicitly dynamic, it's essential to know the entirety of your alternatives. Despite the fact that contraception can help forestall pregnancy, it will not benefit you in any way in the event that you're not taking it on schedule or transforming it on a case-by-case basis. Furthermore, contraception prevention strategies, in any event when taken inaccurately, can fall flat or fail. This is what you can do to guarantee that you have the correct conception prevention strategy and are utilizing it accurately. 1. Investigate your contraceptive device. On the off chance that you haven't as of now, you might need to go on conception prevention. There are a few hormonal and non-hormonal alternatives. Hormonal methodologies incorporate the accompanying day-by-day blend. Pills contain estrogen and progestin, two manufactured chemicals like the ones made by your ovaries. Everyday mini pills contain just progestin. Skin patches contain estrogen and progestin and are worn for 21 days. They're taken out for 7 days prior to changing to another fix. Vaginal rings are another hormonal alternative. They're additionally worn for 21 days and eliminated for 7 days prior to being supplanted. Intrauterine gadgets, IUDs, can be hormonal or non-hormonal contingent upon the gadget. They can be worn for 3 to 10 years. 2. Ensure you're utilizing your contraception effectively. Your possibility of turning out to be pregnant increases with every day you're not on anti-conception medication. Here are a few hints you need to know to ensure your conception prevention is powerful. You ought to take the pill consistently. On the off chance that you take the pill too soon or past the point of no return, it can upset your hormonal equilibrium. This can make the pill less successful. Keep away from missed dosage. At the point when you miss a day, your conception prevention turns out to be less successful. Take a missed pill immediately. On the off chance that you miss 1 day, accept the pill when you recollect. On the off chance that you miss 2 days, you can either take the 2 pills immediately or on various occasions during the day. On the off chance that you missed a fake treatment day, discard the non-hormonal pill and resume your everyday use. Supplant the ring or skin fix on schedule. On the off chance that you neglect to change to another ring or skin fix, you're not insured against pregnancy. 3. Stay on time. Your month-to-month anti-conception medication timetable may not be the same as the scheduled month. That may make it harder to recall when to get and turn your contraception on schedule. Set up programmed reorders with your drugstore so your medicine is prepared when you need it. Auto-conveyance gives you the alternative to have your remedy conveyed to your entryway. You can do this through your drugstore or by utilizing an application. Versatile applications that track your period and contraception are likewise a simple method to remind you when to take your pill and when you need a top off. 4. Bend over by utilizing obstruction security as well. Anti-conception medication is profoundly viable at forestalling pregnancy. However, it will not keep you from explicitly diseases. That is the reason you should bend over by utilizing boundary insurance. Condoms are the best way to forestall STIs, and including a hormonal anti-conception medication builds the insurance. Try not to utilize male and female condoms simultaneously. Male and female condoms are accessible at your neighborhood pharmacy or well-being facility. You can likewise talk with your PCP about getting and utilizing condoms. 5. Ensure you're utilizing condoms effectively. Condoms are futile in case you're not putting them on accurately or in case you're utilizing some unacceptable size. To utilize a male condom, you ought to spot the condom on the top of an erect penis. Pull back the push first if the penis is uncircumcised. Make a point to squeeze the freshen up of the condom tip. Cautiously unroll the condom right down. Hold the condom at the base prior to pulling out. After you pull out, eliminate the condom cautiously and throw it in the garbage. Never reuse a condom and never utilize two simultaneously. With a female condom, the shut end has a thick ring that keeps the condom set up in the vagina. The open end has a meager ring that covers the vaginal opening. To utilize a female condom, you ought to locate an agreeable position. Hold the short end. At that point, press the sides of the inward ring along with your thumb and pointer. Supplement this end into the vagina. At that point, utilize your finger to push it in quite far until it leans against your cervix. Guide your accomplice's penis into the condom opening. Stop if the condom is driven into your vagina or if the penis slips between the condom and the vaginal divider. 6. You can likewise follow your fruitfulness and avoid sex during ovulation. You could likewise follow your ripeness and evade sex while you are ovulating. There are applications that you can use to follow your feminine ovulation cycle. In any case, this strategy is just successful in the event that you take as much time as is needed and truly become more acquainted with your body. All things being equal, consider it as a decent supplement to other anti-conception medication choices. 7. Have crisis contraception, convenient. Contraceptives in some cases fall flat, yet you actually have alternatives. EC can help forestall pregnancy in the event that you've had unprotected sex or your contraception didn't work. There are two sorts of EC accessible. Hormonal EC pills. You can take hormonal EC pills immediately, or as long as 5 days after sex. Be that as it may, it's best when taken inside the initial 72 hours. You can buy EC pills at your nearby drugstore, or, in case you're protected, get a solution free of charge since it's viewed as a deterrent consideration. You ought to likewise keep a couple of EC pills available simply on the off chance that you may require it later on. Crisis IUD contraception. Your primary care physician can embed the copper IUD as long as 5 days after sex to forestall pregnancy and can keep going for as long as 10 years. Similarly, as with EC pills, the crisis IUD can be free or easy with most protection plans. 8. Consider long-haul anti-conception medication choices. You could likewise think about long-acting strategies, for example, IUDs, in the event that you need something that is more dependable however, requires less exertion. All things considered, copper T IUDs are successful to such an extent that they're utilized as crisis contraception. IUDs are little T-molded sticks set in your uterus. They keep sperm from entering your uterus by thickening your cervical bodily fluid. There are 5 unique IUDs available. Paragard, the non-hormonal copper IUD, successful as long as 10 years. Mirena, a hormonal IUD, affirmed for as long as 5 years of utilization. Liletta, a hormonal IUD, viable for a very long time. Skyla, a more modest hormonal IUD, additionally compelling for a very long time. Kylena, a fresher hormonal IUD, useful for a very long time. 9. Think about something perpetual. On the off chance that you don't need youngsters and need something to set and fail to remember, at that point talk with your primary care physician about sanitization for long-haul insurance. In ladies, the fallopian tubes are impeded so the egg can't head out to the uterus. In men, the sperm is kept from being delivered during discharge. Some disinfection strategies may not work immediately, so you should utilize reinforcement anti-conception medication techniques until your PCP gives you the all reasonable. Thank you for watching. Kindly like, share, subscribe and turn on the notification bell for more updates on future videos.